We're fine, isn't it? It works.
Good afternoon, guys and gals. Welcome to Jonesboro Rotary for this second or third meeting in January. Glad to have you all here. I'm going to call on Charles Odom for our invocation.
And here comes Charles.
Over our kids' van.
So it's Rotary prayer. Open our eyes that we may see, open our ears that we may hear, touch our hearts that we may love, clear our minds that we may think, strengthen our hands that we may work. Amen.
Thank you. Mark's picked a great day to be down in Florida playing golf, didn't he? He's not here, I'm filling in. And Van?
Yes, sir.
Jeremy's not here. Let's see what you got for us today.
Yeah, I've got some news for the club here. We have some guests. Of course, they're guests of the clubs. We've got Candy Torgeson, Matt Rosser. I'm sorry, Matt. Manny Espaniza, and he's the guest of Phil Stone. He's from the Moore County Rotarian. He's a Moore County Rotarian. Manny, what club are you in?
Well, I am technically speaking in the Rotary Club in Huacho, Peru, but I transferred from the Rotary St. Hills to Peru, and now I'm back on the States, working on the States, working in the county, working with Bill Stone, and but here I am.
Fantastic. Thanks for coming in. That is great. And maybe someday you could give us a program on your native country or something like that.
Sounds good, yes.
Great. Wouldn't like to be calling you. Okay, we don't have any other visiting Rotarians today.
We have some announcements. John, you have an announcement.
I do. It's kind of a program announcement. We met as a board this morning, and a couple of the upcoming meetings. We are not meeting next Thursday for lunch. We are meeting instead at CUOC, Christians United Outreach Center, at 8:30 a.m. to do backpack pails. So if you can put that on your calendar, please. Certainly will be in the bulletin, but next Thursday, 8:30 a.m., we are meeting at CUOC. It takes literally 45 minutes. We normally say it's an hour. It doesn't take an hour. But we're not meeting for lunch next week.
Hey, John,
Yeah.
are you going to call Jim, or do I call Jim to wake him up?
I think, yeah, why don't we both?
Okay.
We'll be his wake-up call. Give me that one.
Can we get a show of hands and the number of people who can be
Yeah,
there?
if you can attend, ideally we need 5 or 6, but it'd be great if we had 8 or 10.
We got, thank you.
Okay, we got it. Thank you. January 24, which is 2 weeks from today, Robert Gilland is going to be doing his annual duties as the White Elephant Auction. Please bring good stuff. Re-gifting is a good thing. If there's something that you're embarrassed about, that is hilarious, that you don't like, that your spouse doesn't like, any of the above, Yvonne.
Bring money.
Bring money to bid on stuff, on
Right.
good stuff.
Bring money.
After all the fun and laughs are done, the proceeds from that will go towards backpack pails and Rise Against Hunger. Speaking of Rise Against Hunger, we're going to be doing Rise Against Hunger on March 9. We're going to do it at the Lions Club Fairgrounds again. So we're still coordinating that, but that's going to be on a Saturday, March 9, from about 8 a.m. to about 3 p.m. So a couple of program notes. Finally, we do have in our leadership, Bill Stone coming in as President-elect, and Bill, we're looking forward to it. Thank you for stepping in. Really are. I hope everyone knows the sincerity that we treat each other with, because if you're new to this club, like Manny, you think, gosh, all these guys do is laugh and joke around. Well, sincerely, thank you, Bill. Jeremy Thomas will be coming in as our President-elect nominee to follow Bill. And Jeremy came and already set up the banners and all, but had to leave early because he had other obligations.
Did you hear that?
Yeah, isn't that like $5 or something like that? No, she brought dessert, so no.
Yvonne
She's exempt.
She's exempt.
Yes.
And finally,
So
On
nobody
the
heard
Sergeant at
that.
Arms Day, she is exempt.
can we get a, oh my gosh, that was awesome for the dessert that Yvonne brought in today?
Yeah.
Okay, thanks, man.
John, thank you so much for bringing us up to date update on all those events. The Rise Against Hunger, that's something I personally enjoy doing. It's a whole lot of fast, fun, you know, the couple hours goes by like nobody's business. You can't slack off, because if you do, the people are like, hey, come on, let's go. And I had to do the bag. I usually do the ceiling stuff, you know, where you just crimp them.
Yeah.
Well, they got me involved in one of these, you know, 5 people thing or whatever, and I had to do the little plastic bag underneath it. You know, it's like, hey, that's the first thing that's got to go up there, is that thing's got to be right there, you know. It's a little bit more challenging than the years before, but any position you do, even putting labels on bags is a ton of fun. Please come and help us out with that most important program. Okay, any other announcements coming for the club at this time? Neil?
Just as an aside, we're hoping to do 26,000 meals this year.
Yeah. And Neil, we will, won't we?
Yeah.
We will.
Absolutely.
Okay, great. All right,
Terry's got something.
Terry, yes, sir.
Yeah, I have a website that's going to be developed called getfreeadvice.com, and I need someone with a master's degree or a doctor's degree in marketing, because this is going to be like a really big website. I'm looking to make at least $500,000 this year from that website, getfreeadvice.com.
Who's giving the advice?
When you find them, let me know.
But I need someone.
You need anybody on the board, or?
No, I need
like
someone.
that?
I just need somebody to help me develop my website, because it's going to be, everybody I talk to, they say it's a good, you know, it's a good thing, but I need someone to help develop a website called Get Free Advice, and I don't know anything. I can video, but I don't know anything about developing a really good, hot website. Because I want to make $500,000 so I can donate at least $100,000 to Jonesboro Rotary Club.
Now, I can put you in front of somebody for $150,000.
Is that a brag? Is that an announcement?
No, it's an announcement. I need help. I mean, that's what Rotary, and you know, I'm thinking that's what Rotary is about, you know, like the family, you know, developing business. So I need someone to really, you know, like, this is the time when the family is supposed to come together and be a Rotary to help me develop this business. I mean, you know.
All right. Well, make sure that gets in the bulletin.
Yeah, so, like, don't let me down, family. I need your help. I need support.
Kate, Kate, you have an announcement? Kate, you want to have an announcement? No announcement? No, I'm sorry. I'm sorry. Mike, do you want to tell us something new going on at Camelback Brewery Wednesday nights?
We've been doing trivia for 2 or 3 months now.
Oh, sorry.
Yeah, no, we're just going to keep doing it. We usually try to tease it on Facebook a little bit on Wednesday. We do live music on Saturday nights. Just trying out some different stuff that may have mass appeal to Sanford, Lee County. Tonight we have an open mic. We're just encouraging local musicians to come out and kind of give them some time in the spotlight and show that we have a lot of local talent here, and try to showcase that.
Sounds wonderful. Maybe we could get a meeting going on Wednesday night or something like that, and have a Jonesboro team or something like that. That'd be cool. Yeah, with a couple of beers. Yeah, I'll do that.
Is Chad playing around?
Tracy played too.
Any other announcements coming for the club at this time? How about brags? Anybody got anything they're really proud of that they want to share with the club at this time? Jerry, you're looking for, I know.
I got something. I got opportunity to, of course, everybody probably seen me, video on movie star guy Brett Buchanan. I did all his shows, and quite naturally we had one superstar there along with Brett, sitting here with us. So I did all 4 Brett shows. I did 2 at the Temple and 2 at the BPOE, and I think I enjoyed his music better than he did. So if you go to BrettCapitalVideo.com on YouTube, you'll see all of Brett Buchanan's videos over the
Sounds wonderful. Way to go. Thanks for sharing that with us if we couldn't make it to the show. That's really neat. Okay, any other brags? Okay, all right.
It's not a
Yvonne,
brag,
thank
it's an
you.
announcement.
Okay, that's fine. Yeah, go ahead.
The newest production at the temple starts today at 2 o'clock. Tomorrow night is the opening night, and it's going to be a fantastic sequel to last year's Church Basement Ladies. And if you have not got your tickets, please go ahead and do it because you will not be disappointed.
She's hired, people, she's hired.
Are you in this production?
She is not. She
No.
should be because she could make all the food for it. But
I'm an ambassador.
I don't
I'm
think she
also a
can make
guild
lutefisk.
member, so I'm helping to prepare the food for tomorrow night.
Now, Peggy's starring in it, right?
no, she's
No.
not.
The next, the
It's the same
next
exact cast as we had last year.
The next one, not this one.
Okay.
We brought the whole cast back from last year, and just to piggyback onto Yvonne, it is a different show than last year. A lot of people are confused that we are just doing the same show we did last year. This is the second in the series of 5, so it's totally different songs, totally different material that they're dealing with, but it's the same cast. So
And it's funny, isn't it?
it's very fun.
All right, there we go. Gotta love that. All right. Thank you,
Especially
Yvonne.
if you
Thank
lived
Jim.
it.
Exactly.
There you go.
Especially if you live.
That's it.
Back to you, David.
Thank you, Dave.
Thank you.
Appreciate it, as always. Now, before I get to our speaker, I'm gonna get Mr. Ransberger up here again. And introduce new member.
Yeah, Tracy Carter, if you'll come on up, please. Matt Rosser, come on up, please. This is one of those special times in our club when we get to induct a new member. And really what we're doing is, Tracy is bringing another member of the Lee County Sheriff's Department, and Matt, welcome Matt. Good to see you. And so Matt is kind of sort of replacing Tracy in a corporate membership environment. And so this is Matt's first impression of sorts with us in Rotary. But Matt, you're about to join the largest civic organization in the world. There are almost 1.3 million Rotarians, and it's an international organization. So everything happens at the club level. So Jonesboro Rotary, I believe it was chartered in 1986, and we do still have some charter members, like Robert Gillen. What was that funny? I didn't call him old.
I'm almost there, I missed it by that much.
Just out of high school.
And you have opportunities to serve. Now, as a law enforcement person, you serve anyways. We know that. That is your profession. But you get to interact, as you're hearing all of our announcements, with more people in the community, and you get to positively impact those people. And the talents that you bring here, we want you to share with us. So if you have opportunities to serve, let us know about that, and we want to help you with that. So we've got a number of things for you. There are the ABCs of Rotary. You can go ahead and preview this stuff when you look at this later on today. The 4-way test, which you'll see the banner right up there that we go by. The pin, which you can have for yourself. Every time we get together, and when we get together for at CUSC for Stop Hunger Now, we're going to put on our t-shirts, and they are working shirts. So it says Rotarian at Work. We were trying to guess if this was your size, and I think we got it. Larry, I think you did well. So I think you got it. Larry Aiken, who's sitting right there, was on it, and he's already got your name badge right there. So your name badge will go back by Bill Stone, who's sitting there back by the name badge box. And of course, your certificate of membership. So welcome.
Thank you.
We look forward to getting to know you better. If you could tell us a little bit more about yourself, family, how long you've been here, employment, that kind of thing, just for a minute or two.
Absolutely. I grew up in Deep River. Was born and raised on Deep River Road.
Oh yeah.
Lived here my whole life. I worked at the sheriff's office pretty much from the time I graduated. I graduated from Lee Senior, went to CCCC, did the 2-year program, went to BLET in Randolph County. Was hired on under Sheriff Billy Bryant and worked until Sheriff Carter come in. I've gone back and received my bachelor's in criminal justice administration from Western Carolina, and also been certified as a latent print examiner and a crime scene investigator through the International Association for Identification. And doing that, I went and left the county for just a couple of years. I wanted to kind of branch out and try something new, and I went up to Raleigh and worked for CCBI, which is their forensic organization.
I need to inject something here, because he's modest. he actually has some of the best training for crime scene investigators in the world. He's in a very elite group in terms of training. So just wanted to add that.
I appreciate it. So yeah, so I went and worked up in Raleigh for 2.5 years and decided that I wanted to come back to the county. I enjoy working here. I've enjoyed just being able to see the people that I grew up with and family and friends and be able to help them out. And so I came back in 2016. Been here ever since and plan to stay here.
Wonderful.
But I've been wanting to join the club, Sanford Civic Club, and I came to a meeting a couple of years ago and just been kind of looking around and really appreciate you guys having me.
Well, so one thing we're going to ask you to do as a new guy, while Tracy gives you the pin on your lapel there, if you, yeah, he's looking forward to this.
I think I'm busy.
Matt, we're going to ask you at the end of the meeting to stand over by the entrance door so we can shake your hand and say hi to you. And Tracy, come on a little closer so we can get Neil to give us a picture here.
I'm new at this, so I took 3.
And Tracy stays on as honorary.
That's right.
Which means whenever you get hungry and you want to come over.
We're not losing Sheriff Tracy and all that, but we do think that, yeah, Matt coming in will be a good boost for us too. Tracy, thank you for the opportunity for having Matt come on.
Well, when I got elected, I wanted to spend some time around good people, kind of offset some of the other stuff that I have to deal with. So this is a great group of citizens, and we'll enjoy it very much. And I'll be back.
Make them feel welcome. Got a whole bunch of stuff now. Thank you, man. Appreciate it. Back to you, David.
Yes, sir. Thank you, Matt. Congratulations. Glad to have you. And we appreciate what you guys do for us in the community. I know you guys have a very dangerous job. It's what happened in Raleigh last night, and we appreciate what you guys do and pray for you guys every day.
Thanks. Thank you very
All
much.
right. Our program today is Candy Torgerson, who is the Executive Director of the Helping Hand Clinic here in Lee County. And I have had the pleasure of speaking and talking to her up here, and what an amazing woman she is. So, Candy, let me turn it over to you.
Thank you very much for asking me to come and talk to your group today. It's exciting to see, like Sheriff Carter said, all the good people and the good things that happen in Lee County. And I'm so proud to be a part of that. And I thank you for all the things you do for our community. I've had the opportunity of getting involved with the Helping Hand Clinic. It became a 501c3 back in 1993, a few years ago. And my husband, Dr. Torgerson, used to volunteer there also, so I kind of was his nurse for a little bit when he would do that. And it started out with Dr. Pate incorporating us, seeing that there's a need in Lee County for individuals that can't afford insurance and are at a poverty level. And in our county back in 2017, 18% of the population here in Lee County are at poverty level. And we had a lot of doctors in our community with a real heart to try and help get medical care for these individuals. And over the years, our Helping Hand Clinic has tried to change with the times and the way that the insurance is hitting people to help meet the needs, the health needs of the community. So if you're a Lee County resident and you're an adult and at poverty level, we try and, when without insurance, we try and accommodate you till your life, something in life changes that allows you to get health care. And for most of us who do need, well, we all need health care, but the cost of medication is almost through the roof. It is through the roof when you don't have insurance at all to have to deal with. And we do have our organization does have 2 individuals hired to just work with our drug companies to try and procure free medication for these individuals. and that takes time and effort and a lot of forms to be filled out. But I'm happy to report I just got the statistics from most of our statistics back, but the two big groups that we utilize, Medicist gave us a report, and then we utilize them. We also utilize a walk-in clinic in our clinic to provide medication, and it was almost $1.5 million worth of medicine through Medicist, and $500,000 from our walk-in clinic. I still have one more little group of people that help us when we have to go to the individual drug companies. But we treated, it amounted to 500 people getting $4,000 worth of medication free this year. That's just their medication. And I also, we have about 13 doctors, providers in our community that give care to a little over 90 people that come in, and we don't do urgent care, but we try and get chronic care, and we've developed a primary health care kind of a deal because we're all so unique in how we learn and our needs that I try and we've got our physicians seeing the same people when they do come in, and our staff working with the same individuals, so we can kind of be more specific to meeting their unique needs that they have coming in. With the financial support of our community and volunteers from the area, being doctors, nurses, lab technicians, ancillary people, we are able to provide, we helped 2,100 individuals last year, either procuring medical supplies. We had 68 diabetics in our community that we were able to provide their all their equipment that they need to maintain their diabetes. And of those, we were able to get a lot of people with insulin. It's like $800 a month for an individual to pay for medicine. And I'm happy to say I just found out the donut hole for Medicare is no longer there for these people that hit the donut hole. They switched that this year. So there were periods of time that our older folks really had a hard time getting, when you just happen to have these diseases, it was very difficult. So we aren't needing to assist them this year with that, but we do assist. Like I said, every year we kind of change to the needs of what's going on in our society with insurance and trying to help them procure that.
Good luck. Thank you.
Our clinic has been open since 1993. We do provide doctor's visits for them. I do have an optometrist that volunteers her time once to twice a month, and she comes in. She saw 86 individuals in our community giving out free glasses, and she's worked a lot with the Lions Club in town to help afford the glasses that she purchases to give our clients. So we kind of connect with other members in the community to try and help us with our things. We also have a big reusing medical supplies. I try and recycle those things that people have used before and they don't need them right now. So like wheelchairs, walkers, dressing supplies, CPAP machines, they're like $800 a piece. When they get new ones and they don't need them, they bring them there, and I can get that back to the community. Anybody in the community that could utilize that stuff, I try and share that with. So that's, I have not added up the figures for that of how much we gave back last year, but I do have the numbers of things we passed out this year for that. But on the little form that I gave you on the bottom of that page is a little circle, and it kind of, in a nutshell, kind of shows what the kind of people that we try and help. We do have a pharmacological needs that we're trying to meet. The dental clinic that we run a dental referral clinic in town. We know that the area's resources as far as who can help people financially get dental care done. If you don't have dental insurance and you're at a poverty level, what resources are out there? But I do have 15 local dentists that will once a month take clients that need a tooth pulled. we do have that, we run that whole program through our facility also. We are also trying to get an initiative here for this year to get our mental health resources in our community developed a little bit more, to get referrals going and getting that program set up is kind of our goal for next year, trying to get the resources available. But you might, I didn't really realize how, I'll just end with a little story about, we've had different clients kind of coming in. We did have a, as far as our optical program that we had a lady, now she gets Medicaid, but she did not get her, they don't cover optical at all for the Medicaid program she was in. So she was able to go through our optician program, and she actually got glasses, and she told me the other day that, and started crying right there in front of me, that she hadn't seen in over 10 years, and she just didn't have the money to go out and get those glasses. And she's in a wheelchair, quadriplegic. It really, it's something to stand there and watch these people put on glasses for the first time, and they hadn't been able to see, and they've learned how to live without seeing too well. We also had a gentleman that was that moved to the area because his mother was very ill, and he had to quit his job and come and take care of his widowed mother. And he was a severe diabetic and had been in the hospital, was very sick, and after he got discharged, he found out, anyway, we got him hooked into our program. So it's been 1.5 years now. We've been able to assist him with his medical needs, and he's been able to assist his mother in the end stage of her illnesses here too, that he hadn't been put back in the hospital since, because we've been able to manage those kind of conditions as an outpatient. So we try and hope our community is a little healthier because of what we can do. We also had a young guy in his 20s come in. This has been a little bit now, but again, he had lost his job and he lost his insurance, and he was a diabetic, and he was too sick to even get reemployed. But once we get his medical condition controlled, he was able to get reemployed and get his health insurance back. So we're kind of a system that just assists people in their low part in their life, to get them so they can jump from there and get back as quick as possible to being productive members of society. So are there any questions from the group? Yes?
I have a question about somebody who is smoking and would like to stop, and is low income. Would you have a program that could help them?
I don't have a special little, we talk. I'm a registered nurse also at the clinic, so I do, when people come in and say I might need that, I could walk them through some things that we encourage our folks. There are actual medications out there nowadays too.
That's what I'm thinking.
So a physician that would order, you've got to have a
patch.
To have a prescription if they go that route, but we could sure educate them on what's out there and what she can do on her own, and then the medical things that they can hook into for that. Yeah. And I might just mention our medication program too. We do have a few of our physicians that see our patients, but there are people in the community that are seeing their own physicians but can't afford the medication, and they're at that income level. So we process their medication through the company too, so they can maintain their private doctor, and we can still procure their medication. And I might just mention, with our problem in Lee County with narcotics and our medication, I just wanted to reiterate what you do with used medication, because we recycle supplies, but when you're done using your medication, it's very important you take care of them in a proper manner. Going to the grocery store right now, this is mustard, honestly. You gotta open it up before you get your mustard out, okay? By federal law, we are able to reuse medication if you have it in a container and it's not outdated for 6 months. The 6 months allows us to process it in and get it out to a person to utilize it before it expires, okay? Now the other thing they found out is when everybody starts pushing all these medicines down their toilet, it affects our water supply in society. So they don't want you flushing medication down your toilet. But the sheriff department and the police department have a container that they recycle medication that's no longer needed. And I just want to really highly emphasize that we keep it going, because medication sitting around does cause a huge problem in our society with people getting a hold of it that doesn't need to be having it. And I just want to really emphasize that there is a system that we can do to recycle it, and it's bringing it to the sheriff or the police department. Moore County had a thing too, that if you take used medicine and crush it up and you put it in cat litter or coffee grounds, put it in a sealed container, you can throw it in the trash and it'll be disposed of like that. But just as individuals in society, to just make society a better place to live, it's just good to recycle our medications properly. Yeah.
Could I just,
Yes.
if I understand this clearly, so if we take meds to the sheriff's office, do they look at them and then give them?
I don't know, Sheriff Carter, I don't know how you look at them, but I know they dispose, it's a huge process to
No,
dispose
but I
of
mean,
medication.
how do you get any of these medicines?
I don't,
You can't take them?
no, they're no good anymore, so do you want to
Okay.
comment
They're
on that?
destroyed, we put them in the incinerator.
Incinerator.
Right.
Yes,
Yeah,
sir.
Candy, on the same token, I heard a program in Rotary a little over a year ago, and matter of fact, Sheriff Carter was one that brought the program, and we were talking about such things about narcotics. I went home and I found 3 bottles of oxycodone or something to that nature, and obviously that was the good stuff, the high-powered stuff that people can abuse. Most of you know in this room that I've got 2 teenage boys, and we don't lock our medicine chest in my bathroom for obvious reasons. So I took them to the Helping Hand Clinic. I didn't know at the time that all you guys would do was destroy them, that you couldn't take them, but Helping Hand Clinic was very nice. I could have taken them to the sheriff's department too. But I actually felt very good that I got them out of my house.
Yes.
And I didn't know they were in my medicine chest. And it could have been 6 months old, and they were probably 2 to 3 years old or something of that nature, from a past procedure or medical thing or something like
Yeah,
that.
and narcotics is a
But
thing we don't.
they were just sitting in there.
Yeah, I appreciate you doing that, because it
Oh,
was an
I
effort
felt
on
good
your
just getting rid
part.
of them.
And we do not accept any narcotics. We
I
don't give
found
any
that out.
narcotics out.
Yeah.
Yeah, and that is one thing we don't touch, and we
Correct.
have you dispense of it. It is just such a huge,
It is, and
I just feel good I got it away into a safe
Yeah.
place.
if I had
You know?
to give one piece of advice to parents
Yeah.
all across America, tell your children to never abuse pills.
Yeah.
Because that is the worst, excuse me, I got a mint in my mouth. That's the worst addiction, in my opinion, that we've ever seen, is the opioid, because it leads to heroin addiction.
That's right.
The people that you hear about doing heroin started out abusing pills. And it's awful. It's like young people are dying.
Yeah.
And I think that if young people knew that popping that pill was the hardest drug that's out there,
Yeah.
they wouldn't do it. But they don't think it's a big deal, and it is.
Yeah, there's
It's
no needle,
terrible.
there's no dirtiness to it.
Yeah.
Matter of fact, it's easy.
Yeah.
Yeah.
And crack cocaine is awful. It's terrible. That's worse than that. So I can't say that enough.
I just encourage everybody to dispense. Yes, sir.
Yes, ma'am. Do you guys work with other non-profit clinics, such as the More Free Care Clinic?
I'm glad you mentioned that. I did not mention that we are a member of the North Carolina Association of Free and Charitable Clinics. We have been for years, and they are also a member of that clinic. So we don't work with them, but we are we are part of their, we're an active member of their association. So we have a lot of laws and bylaws that we go along with, yeah.
And just to add on the note about the disposal, I believe First Health Pharmacy takes those past day
Medications, and a lot of, like Walgreens does too, we're finding more, I haven't gone to all the drugstores in town either, but they're starting to put little containers out there for people to dispose of their
I think for
old
those
medication.
medications, the pharmacy straight in takes it in and they dispose it through their autoclave and stuff like that, yeah.
But if we have antibiotics that
Yes.
we're not using, we can bring them to you?
The bottle has to have this on it.
Okay.
A seal. It's got a, and the mail order medicines are doing that now, and who would guess we would, as a society, have to cover up mustard so nobody tampers with it. But by our federal laws, we have to, if we take it in to reuse it, it has to have the seal on it so they know for sure nobody's touched it or tampered with the stuff, so, yeah.
Basically, yeah.
Yeah. Any other comments or questions? I feel very honored to be, if you all don't just mind standing up at your chair. You get to the back of your chair. Stand at the back of your chair. And then I just want you to do a circle and sit down.
If you've got DVD,
And I just want to take this opportunity to say thank you for letting me come here and talk to you, turning your world around a little bit to let us know and hear what we're doing here in Lee County for our uninsured, for individual adults with needing health care. Thank you so much.
Man,
Yes, sir.
you want to,
Yes, sir. Today, we raised $64 for the Polio Plus campaign to eradicate polio. $32 to the winner and $32 to the campaign. Candy, if you would, pull a ticket for me. And let's see here. We got
Oh,
two
did I
here.
get two?
Ooh, that's okay. That's okay, now we got one. Okay, and the winning number is 4071. 4071. Neil! Okay.
Lucky number.
All right.
How many times, Neil?
Okay.
Once a month.
No problem.
You need to reach in there and grab a raffle ticket for me.
Okay.
And we have
There you go,
gone
sir.
The year I
over
graduated from West
500
Point.
today.
Yay.
Well, Charles and Martha are the brothers. But I plead insanity. I didn't bring the checkbook. You'll have to check with me next week.
last week.
2 weeks in a row. No, 2 weeks in a row. I'm senile. But I've got you covered.
Thank you.
Yeah, you're gonna have to go to COC to get it.
fabulous job you're doing as always. Next week, we will be at CUOC at 8:30 in the morning.
Most of us.
Some of us.
Some of us. Some of us may need to get a phone call to be there at 8:30 in the morning, but we'll be there. Neil, you want to lead us out of here for the day?
Before we test the things we think, say, or do, first, is it
true?
Is fair to all concerned? Will it build goodwill and friendships? Will it be beneficial to all concerned? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Have lunch with you.